Okay, good morning, everybody. We're going to get started. Welcome. My name is Catherine Gibb. I work within a Housing First program in Mississauga, in Ontario, and I'm the moderator for today. You've chosen a great session to come to for the last session of the conference. We're going to begin with a land acknowledgement. We would like to begin by acknowledging the 2025 National Conference on Ending Homelessness is taking place on unceded Indigenous lands. The Ghanaian-Gihaga Nation is recognized as the custodians of the lands and waters on which we gather today. Jajaje, Montreal, is historically known as a gathering place for many First Nations. Today it is home to a diverse population of Indigenous and other peoples. We respect the continued connections with the past, present, and future in our ongoing relationships with Indigenous and other peoples from coast to coast to coast. All right. So this session is going to be in English. So if you would like the translation, I encourage you to utilize your headsets. We have one session today, so we're going to spend our time on empowerment and social inclusion in Housing First with the Empowering Paths to Stability, the Impact of Peer Support in Ending Homelessness program. Your presenters are going to be Satvir Atwal, Program Manager, Good Shepherd Nonprofit Homes, and Ali Baker, Good Shepherd Nonprofit Homes. We'll go through the presentation and then we'll have a Q&A session at the end of the presentation.
All right, good morning, everybody. Welcome to our presentation. My name is Ali Baker. My pronouns are they, them. I am a peer support worker with the Good Shepherd Homes program.
My name is Satvir. My pronouns are he, his, and I'm the program manager with the Good Shepherd Homes program. And today we will be presenting on our peer support program within the Good Shepherd Homes. We want to start with the land acknowledgement of where we work and live in, the city of Hamilton, which is situated upon the traditional territories of Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. This land is covered by the Dish with One Spoon, One Pound Belt Covenant, which was an agreement between the Haudenosaunee Anishinaabe to share and care for the resources around the Great Lakes. We further acknowledge that this land is covered by the Between the Lakes Purchase 1792 between the Crown and the Mississaugas of the Credit First Nation. Today, the city of Hamilton is home to many Indigenous peoples and settlers from across Turtle Island, and we recognize that we must do more to learn about the rich history of this land so we can better understand our roles as residents, neighbors, partners, and caretakers.
Also, at the end of every land acknowledgement that we do for work, we take a moment to talk about either recent events that have happened with our Indigenous or Native community, or any upcoming events. I know in Hamilton we have a local, it's called an Aboriginal Center. It is called Dua Dedesne. They recently started doing a powwow for neurodivergent children, so parents can go out and do that. It started this month. Otherwise, if you take a look, most people have an Indigenous local community that will run events that are open to the general public. So we encourage you to go and take a look at that and engage with those who guard the land.
A little bit about this session interview, how we're going to unfold our session and what we're going to talk about. And first, I'm going to start with a little bit of the history. And I think that's why we're all here today, is over the past few years, we have witnessed a significant rise in homelessness, a crisis influenced by multiple factors, such as economy instability, mental health challenges, physical health challenges, and lack of accessible and affordable housing. That has played a major role. These often does not exist in isolation, but these factors interconnect, and that makes individuals who are unhoused finding and navigating the system really difficult. And also, I think understanding this context plays a big role because that helps us design and makes us understand what supports will be helpful and effective, and making sure that it's compassionate and helping people access those supports easily.
In response to these challenges, peer support has emerged as a crucial and transformative approach. Peer support workers create spaces of trust, connection, and understanding where people can share their stories and experiences openly. Through shared lived experiences, we empower others on their recovery journeys, not by prescribing solutions, but by walking alongside each other. We offer emotional encouragement, practical advice, and hope that is grounded in real-life understanding. This kind of support helps bridge gaps between services and those using services, especially for people facing housing instability and health challenges, whether the challenges are mental, physical, etc.
Yeah, so here's our today's session will unfold. First, we'll explore the evolution of peer support program within the Good Shepherd Homes, tracing how it has grown, adapted, and evolved over time. Next, we'll discuss the philosophies behind the peer support program, emphasizing empathy, mutual aid, and shared experiences. We'll then move into the outcomes that we aim to achieve through these interventions, focusing on recovery, stability, and empowerment. So the takeaway goals that we want to achieve and we want everybody to take away with you today are...
Yeah, I'll go ahead. Thank you. One of our main goals for today is that everyone who is here walks away with actionable ideas and strategies for effectively integrating peer support roles into housing stability initiatives. At the end of our presentation, we hope you all will have a clearer understanding of how to leverage peer support, not just as an add-on, but as a core element to recovery and sustainable housing. Ultimately, we want to empower you to help people not only find housing, but also to truly build lives of stability, dignity, and hope. Quick note here, before we go back to the script. Everybody has handouts, hopefully. If not, they're on the app. On the handouts, the last page, we have a little section to take notes if you want. We'll also have an exercise of answering and asking questions. So you're welcome to go through it if you want.
Yeah. So what is HOMES? So HOMES is the on-site mobile and engagement services, with on-site mobile and engagement services. The core principles of HOMES program is housing first, recovery orientation, and harm reduction. The services being offered at HOMES program are housing, life skills, peer support, health and wellness, social recreation, addictions, community integration, and vocational support. There's also on the handout, there's more thorough information about the program. So if you guys want to look at it and have any questions, you guys can ask us at the end. So next we're going to talk about the evolution of peer support program at Good Shepherd. So the HOMES program began as a collaborative initiative with several community organizations, including Mental Health Rights Coalition. From the very beginning, this collaboration was rooted in partnership, shared learning, and deep respect for lived experiences. One of the key strengths of this program has been active involvement of peer leaders within the community. Their valuable feedback, recommendation have played a major role in shaping and strengthening our community. Also, the voices with the lived experience have guided our growth every step of the way. And both our current and previous directors have worked closely alongside peer leaders to enhance this program. Together, they have ensured that it continues to align with core values of a Good Shepherd, like quality of service, compassion, and strong sense of responsibility towards the people we serve.
Next, we'll talk about the training and resources for peer support. Good Shepherd really values proper training for peer support workers. For those who don't know, peer support workers can get certifications through PeerWorks PeerWorks Canada, or through different smaller organizations. Outside of this certification, it's really important that peer support workers get training to properly support those receiving care through different initiatives. The training that HOMES gives not only aligns with the policies and procedures, but it focuses on meeting the unique needs of peer workers, while also advocating for additional resources like our employee assistance program. Another couple trainings that I'm really proud to receive as a peer support worker are the nonviolent crisis intervention, thank you, which just kind of hones the skills on how to support somebody who's in a crisis without resorting to carceral actions or perpetuating more harm. We also have mental health first aid, which I really liked doing, along with the ASSIST program. ASSIST is ASSIST, I believe, and it supports how to navigate suicidality, either with somebody who is actively in that crisis or somebody who experiences that chronically.
And specialized supervision and mentorship also plays a big role. And we, as a manager, I think when I first started, I did get a training from Robin Priest, who is the leader in peer support education. This training helped me as a manager develop the skills needed to mentor, supervise peer support workers effectively. It was about creating a supportive, trauma-informed environment where peer workers can thrive. Since its beginning, peer support has become an important component of the HOMES program. Peer workers now play an active role in program design, facilitating peer groups, and even co-chairing a tenant advisory community. This ensures that the voices and needs of service users within the HOMES program are not only heard, but also truly valued. We continue to build a program that truly reflects the mission and value of Good Shepherd. Here we could play a small video that from our director, John Lee, sharing his thoughts about peer support program within HOMES. Hope it works.
I want to take a moment to talk about peer support, because in HOMES, it's not just a role, it's a practice. Peer support is grounded in shared experience. It's built on the understanding that recovery isn't linear, that sometimes the most powerful connection comes from someone who's walked that path themselves. In one-on-one settings, peers don't intervene, they connect. They model hope, they normalize struggle, they create safety through authenticity. It's less about assessment and more about presence. In group spaces, peer support changes the dynamic completely. It shifts ownership of recovery back to the people in the room. The power isn't held by a facilitator, it's shared, relational, and often transformative. Clinically, it complements what we do. It builds trust faster, sustains engagement longer, and reminds all of us that recovery isn't prescribed, it's experienced. That's what makes peer support essential. It's not a supplement to care, it's a cornerstone of it.
Yes, it is my turn to go off about peer support. Oh, things are working, sorry. We warned ahead of time that the subtitles might not work, and they're fine. So now I can start. So the question on the slide is why peer support matters. Peer support is a necessary and integral part of any successful housing stability program. The director previously mentioned how trust is built faster with peer workers, and that's true. Peer support is meant to build long-lasting and trusting relationships that will allow people to heal from damage during their lives, which can look like folks not feeling comfortable seeking support from clinical staff due to some ethereal care, and also just some doctors suck. But with peer support, a peer can attend those visits and just lower barriers as a silent witness. Also, we can plan ahead to collaborate on how to deal with stressful situations, which in my life has looked like having a partner or a friend come to a doctor's appointment when my memory wasn't working. We would talk ahead of time of this is what I want to say, this is what I really care about getting across to the doctor, and this is what we do if I stop being able to communicate. That's something I also provide to people. Peer support also bridges gaps when it comes to care. We all hope we don't have internalized stigma or internalized biases, but we do. Peer support workers like me are able to fight that not only by connecting with my colleagues in one-on-one or group settings and normalizing struggles that they also go through, but I also get to show up and support my tenants or peers in feeling more safe and comfortable when engaging with staff who are either clinically trained or social worker trained. We promote empowerment and resilience through advocacy, so it's really important that folks learn how to tell their stories in a way that feels empowering. The narrative we tell ourselves is invaluable. Like, it is necessary. Human beings are kind of a bunch of stories put together. The stories we tell ourselves and about ourselves define our lives. Thankfully, they're changeable. So supporting someone in moving from, hey, this happened to me, these people did this to me, to this is something I lived through, this is what I took from it and how it shapes me be better. Someone being able to own their story and own their lived experience allows them the feeling that they deserve control over their lives, that we deserve control over our lives. It means someone can make steps to shape their life in a way they want. Essentially, it's self-determination. Along with that, cost-effective. I don't know if anyone here has sought support from therapists, shrinks, counselors, or anything. It takes a long time to trust. It takes a long time to trust a clinical staff, even if they're the kindest person in the world. Peer support, it takes less time. We kind of just vibe well. And so because of that, it means there's less cost associated with paying for therapy sessions. And I think the last one is we complement clinical supports. Peer support isn't meant to eradicate clinical support. Medicine, doctors, therapists, everyone has a role to play. Peer support is just meant to support the person receiving services to move away from feeling like a victim or from somebody who is a patient into feeling like you are in control of your life and you're able to talk about what you want and what you care about from others. Yeah.
Some of the philosophies and peer support values. You want to talk about the peer support values?
Absolutely. I don't have them listed, unfortunately. Perfect. Yay. No, I do have them. Sorry, it's on the handout. Did I just?
That's okay.
So, peer support values. The core values of peer support are hope and recovery, self-determination, empathetic and equal relationships, dignity, respect, and social inclusion, authenticity and trust, and lifelong learning and personal growth. Peer support relationships are meant to be equal. I am not a clinician. I don't have all the answers. None of my peers have all the answers either, but I have learned more from the people I get to hang out with than I've ever learned in class or in school or in therapy. Yeah.
And as you mentioned, I think Ellie mentioned how it differentiates from clinical support and also complements at the same time. So in traditional support, the model often works from a hierarchical where counselor, therapists, or professionals are seen as the expert, providing guidance from the position of authority. However, in the peer support, the focus shifts from shared experience. Here, individuals connect based on mutual understanding and lived experience. This hopefully creates a sense of community, equality for people walk beside each other rather than one leading from above. In traditional settings, support often takes from prescriptive guidance. Professionals follow standardized protocols on treatment plans. While well-intentioned, this approach can be sometimes miss individuals' nuances and each person's experience. Peer support, on the other hand, thrives on collaborative exchange. It's about sharing personal insights, coping strategies, and experience in an open and empowering dialogue. Rather than being told what to do, participants are encouraged to explore what works best for them in a collaborative setting, which is led by a person seeking peer support. Finally, traditional support often centers on expert-led situations where professionals diagnose, advise, and intervene. This sometimes led to a sense of dependency or diminished self-confidence. Whereas peer support emphasizes experience-driven learning, here every person's story becomes a source of knowledge. People learn from one another, gain confidence, build resilience together, and this collective growth is what makes peer support so powerful and transformative.
Absolutely. Yeah. Before we move on to the next slide, I just wanted to give a quick note on what expert-led solutions versus experience-driven learning can look like. I got diagnosed with fibromyalgia a few years ago now, before getting this job. And there was a point where I was waiting to get a diagnosis to receive treatment from specialists. And my symptoms were getting so bad, I'd stopped being able to use my hands. So I'd reached out to my specialists to say, hey, this is real bad. I'm 24. this is not good. And my doctor then said, we don't have answers. What you can do is look for people who have similar symptoms to what you have and find out what treatments have helped them. That allowed me to, not me, my partner did it because I couldn't use my hands and it was through text. He reached out to a friend with lupus and another friend with osteoarthritis. And we got recommended just a pain relief lotion that was a game changer. It allowed me to start doing hand exercises and gain mobility back.
Would you like to talk about how your work does in recovery and housing outcomes?
Yes, absolutely. So with peer support, I want to take a moment to talk about the support that I provide with homes. So peer support looks very different. You can have with clinical, you can have personal. My support is community-based. So I do one-on-one groups along with my other colleague who couldn't be with us today. Him and I are the two peer support workers. We each have a one-on-one caseload. We see folks usually for at least an hour every week, talk and work together. I also run a weekly group with some of our recreational staff. It's called the Homes Sociable. We get together, we do events. Sometimes we visit the library. Folks bring up their own ideas. So we made paper flowers one day because someone taught and someone ran the group. And then we have the monthly community cafe where me and Jeremy are available to chat with our community. We get together, usually eat food and do crafts. And then we do a weekly 12-step program. Me and Jeremy switch who chairs, but it's called Dual Recovery Anonymous. Dual Recovery Anonymous is important because it recognizes that some folks will need psychiatric medication or other medication in order to live a full life. And unlike other programs, that doesn't take away from you being in recovery. There are 12-step programs that say you have to be fully abstinent in order to be recovered, and we don't do that. In terms of how it's affected the actual program on the whole, we find that folks who receive peer support, or at least events where peer support workers are, people are more engaged, they're more chatty. Folks also say they have improved quality of life, they feel seen and heard, and we support a lot with resource navigation. Peer support isn't meant to be a catch-all. The goal here is that somebody works with me, get resources, and then eventually they graduate from peer support because their life is so full of all this other stuff that I'm not necessary, that peer support isn't working anymore. That can look like going to groups, connecting with the other communities that started homes on the whole, so like CMHA, and getting someone out and about. So that meeting with me is just icing on the cake.
Do you have any examples you want to share?
Oh my goodness, do I have examples? Yeah, sure. An example of doing like what supporting someone with resource navigation or getting more support looks like. I have some folks with chronic pain. I don't know if anyone here experiences chronic pain, but it is wild. And I've had folks who have worked with homes for a long time, and clinical staff or mental health staff look at someone and they're like, this person is, unwell. They're a little more agitated. We're not sure why. And then I get to go in and be like, oh, they have spinal pain. Okay, have they seen a specialist? No. Okay, so we did a referral for a specialist. My person was really anxious about going to see the specialist, so I went with them for the first couple appointments. The specialist then did a few scans, gave the person an accurate diagnosis, provided pain medication, and that person hasn't had pain for the first time in 30 years. They're now able to sleep at night for the first time, and I still get to see them every week. But now instead of talking about how to live a full life when you're under extreme pain, we now get to talk about how to live a full life when pain is well managed.
Thanks, Ali.
Yeah.
So next we will talk about some of the professional reluctance that we experience, or Ali probably have experienced.
Yep.
So would you like to talk about any of the professional reluctance that you experienced?
Yeah.
Well, yeah.
Absolutely. I'm glad we got a video of my director in this presentation. I have to start this by saying I haven't faced much professional reluctance. And he's a big reason for that, as is the management team. It is extremely common for peer support workers to face a lot of ableism, to be isolated in whatever program they're in, because peer support workers aren't able to navigate a lot of complex social situations that some people have. How do I put this? It's common for us to be treated like our expertise doesn't matter because it is not quantifiable. We don't have a degree. We don't have any sort of certification saying, hey, this person did 6-8 years of training and they now deserve to talk to people. Workplaces will have peers be on the outskirts, not involved directly, and it contributes highly to peer burnout. Yeah.
Oh, thanks. And next we'll share some of the key acceptance strategies that we used at Good Shepherd, such as education and awareness. At Good Shepherd, we prioritize ongoing education for all staff about the values, purpose, and boundaries of peer support. This education helps reduce stigma, builds empathy, and fosters a mutual respect and understanding of peer roles. Co-creation is also important because involving peers in designing, implementing, and evaluating support programs. By doing this, we create a sense of shared ownership that promotes buy-in and ensures the model truly reflects the real needs and lived experiences. When peers are part of building the system becomes stronger and more authentic. From the very beginning of the Homes program, we made it a priority to define the scope of peer roles. You'll see it on the handouts as well, the role description, reporting lines, and the limits of responsibility. Having this clarity reduce confusion, prevents overlap, and build professional trust between peer workers and clinical support team.
Just before we move, so on the handout on page 1, there's the bottom of it, I know we have one up here. So page 1, it shows, I think, peer activities or something like that.
Yeah.
Okay, perfect. So that is pretty much my document from HR. It talks about the activities that peer workers do. I actually have the HR version of this hanging up in my little cubicle at work. So if I start feeling wibbly-worbly about what I'm doing, or I start feeling really stressed, I can read through it and use it as a checklist to be like, okay, what am I doing? Am I doing a good job? And then I get to move forward. I also, thankfully, feel very safe and comfortable approaching anyone to debrief and chat. I love my management team, which is the first time I get to say that, even though I've been working for 14 years. But this allows me a tool to just do it on my own, if I want.
And celebrating success is powerful. We make it a point to highlight the success stories, positive outcomes, and contribution of our peer workers. By showcasing these wins, we demonstrate a tangible value of peer support and strengthens across all levels of the organization. And do you want to talk about how? Yeah, next
Absolutely.
we'll talk about how and the key steps that can be taken in building and sustaining a strong peer support program. And each of these elements play an important role in ensuring the program is effective, sustainable, and aligned with your organization.
Yeah. So the first step is assess readiness and capacity. Before launching or expanding a peer program, we need to evaluate whether or not the organization has the structure, culture, and resources to support folks effectively. This includes leadership commitment, staff buy-in, and systems in place to sustain peer roles. If anybody wants resources on that, my email's at the back. A few different places have actually created documentation on what questions to ask your staff in order to assess if your colleagues are ready to have a peer worker on your team. Peer workers as individuals can cause stress to clinical or healthcare trained folks because we bring a different vibe. So it can be good to check in with your folks and be ready to have conversations as management or leaders in your organization.
Yeah. And clearly define the roles because it ensures everyone understands the responsibility, boundaries, and reporting structure. It clarity helps avoid confusion and builds professional trust between peer workers and other team members.
Yeah.
And thoughtful recruitment is also important. Bringing in peer worker, we want to look at beyond qualification and seek individuals who bring lived experience, empathy, and a strong sense of purpose. The recruitment process should be inclusive and supportive, reflecting the values of peer worker.
Yeah, my interview for this program was actually one of my favorites. I got to sit with the director and the person who would become my manager, and we got to role play through what would happen if me as a peer worker was faced with a colleague who didn't accept my job or who became rude. And I made my director be the rude person. But it was fun, and I felt like I was valued and important. The next one we go through is training and orientation. So once recruited, individuals should be provided with comprehensive training and orientation. Training, again, should go beyond certification. It should include organizational values, trauma-informed care, communication, and self-care. This will help peer workers feel confident, supported, and ready to succeed in our roles. You also need to look for opportunities to provide professional development. Another reason peer workers burn out is because it's it's not a new career. Peer support is rooted in a lot of Indigenous practices, the idea of valuing elders and mentors. But in professional settings, it's difficult to go up. There isn't really a ladder to climb when it comes to peer support. So opportunities where peer workers can talk about their experience or engage with other leaders is huge. This is an opportunity like that. I get to come out here and meet people who care about experiences like mine, and I get to work directly with my management staff and be involved in informal team building, like going out for dinner. It's rad.
And training is not just important for the peer workers or the frontline workers, it's also for the supervisors as well. It should train to understand the unique needs of peer workers and provide trauma-informed and reflective supervision to maintain well-being and professional growth and program integrity. And do you want to talk about the integration within the team, how important that is?
Absolutely. So I think I mentioned earlier about how teams, like there can be ableism and issues with being a peer. So something Homes does that is really, really valuable for integrating is being invited to other work events. Homes is a pretty big program. We have actual locations that Good Shepherd owns, and Homes acts as a landlord. We also have transitional housing. We've got people in for-profit landlord buildings, but Homes has the unit. So whenever a team has an event, I get an invite. This means at Christmas, I go to every Christmas party. At Halloween, I go to Halloween parties. If the teams are doing a fun event like Collective Kitchen, where tenants or our peers can come out and cook, I get invited. I also travel a lot for work. I go to these locations on my own. So we have things in place so that everyone knows where I am. And if I forget to put down where I'm going, a manager reaches out to me. And it's like, hey, Allie, where are you? And that really helps me feel seen and like I'm not just on the sidelines. With colleagues, you can, as a manager, I think, give feedback if a colleague expresses frustration. Something I've faced is coworkers thinking peer support is too loosey-goosey, that it's because it is based on the person receiving the support, it is very open to what it can be. And I've had staff express concern that because it's unstructured, it isn't supporting somebody in creating a structured life. And thankfully, my managers step up and have those conversations, so I don't have to.
And next is developing a strong referral network. And I think at Good Shepherd, the community mental health workers are the part of the frontline team would send a referral to the management team, and then that gets discussed or with the peer worker who's going to be assigned or who will be working with their peer to gain a deeper understanding and how this could be like a good fit and what supports can be provided provide stability within their homes. And also peer workers should know where and how to connect service users, so we all work as a big Good Shepherd organization. If something that is not within the homes, we have a Barrett Center, we have other programs or services that the referral can go to, and so we can all bring other supports that are available to them. to make sure that we strengthen the continuity of cares and help participants access the full full range of services they need.
I want to jump in again, I'm
Yeah,
sorry.
go
On Teams, Good Shepherd Homes has like a giant Teams chat, and we actually have in there I guess a page that's just called Community Resources. So me and Jeremy get to chime in with resources we have, but also my teams get to chime in with resources they've found. We have lists of food banks in the area. We have like the referral I talked about earlier with the person with chronic pain. I actually have a copy of that the referral you can fill out in that as well. So other tenants who I'm not able to connect with, because peer support isn't on every single team, the team can use it and go and do that, which is really helpful.
Yeah, so sure. For long-term success, sustainability planning is essential. This means securing funding, building internal leaders, and embedding peer roles into organizational structures. We would all want peer support to be seen not as a project, but as a permanent, integral part of our services. And finally, we need to foster a strong peer network and creating opportunities for peer workers to connect, share experience, and support one another, just not across the organization, but beyond that, so where peers can share their stories, share their experiences, and also bring valuable insights to provide better care and supports that needed. A strong peers network helps peers feel valued and stay engaged in their roles.
I'm going to add in here as well. Something I have found as somebody who runs peer support groups, I run peer support groups. A lot of folks they want to be generous. I think we all want to be generous. We all want to provide care, and we want to receive care in a way that makes us feel honored to give it and us feel honored to receive it. By being somebody who's recognized in homes as a program, when I go into groups, I get to engage with folks and support the mutual learning. I have some of my peers who talk to me now asking to either volunteer in our little cafes or asking to run groups like the one that made paper flowers. And that is not possible if peer support is isolated. It's really important to have like a strong network, and people get to receive peer support from other areas as well. I know CMHA in Hamilton has a peer support group, and some of my peers share that. They have me as peer support and also them.
And I think, in summary, building a peer support program takes a thoughtful planning, collaboration, and commitment at every level. By focusing on readiness, structure, support, and sustainability, we can all create a program that empowers both staff and service users and it truly reflect any organization's mission and values. Do you want to do something? Yeah, we have a couple of questions that we would like you to think about, share with us or one another here. Do you want to ask the question?
Yeah, absolutely. I forgot to provide pens, so hopefully everyone has pens, and if not, we can just chit-chat about it. The first reflective question is, how can peer support reshape our approach to housing stability in your organization? If anyone has any ideas, just put up a hand.
Sorry, forgive me. I'm very passionate about this, and I have been searching this entire conference for the recovery-based model, and this is like, you guys are sitting on a gold mine. So I'm a person with lived experience. I've got 5 years clean. I manage a provincial program, and I have been trying so hard to communicate that this isn't necessarily an addiction thing, although addiction is a great way to like frame it, and it's because it's clear. Recovery, how did you get this? How did your director get the funding for this? Because I've tried to build the value in the recovery-based model, because it's a human problem. You're starting with the actual issue. You're not starting with the homelessness. And thank you. How do you do it?
Yeah. Are you cool if I take this for a second? Okay, cool. I have no idea how my director finds funding. I have heard rumors throughout the organization that he is extremely skilled at finding ways to get funding. I got no clue. I know he's good at it. With how it was shaped, so Sapphire talked earlier about how Homes was a collaborative effort. John has talked about how it was like CMHA, I think schizophrenia supports in Hamilton, the Alzheimer's Society in Hamilton, and a few other organizations that came together, found funding, and began providing rapid housing support. So taking people right off the street, putting them in housing, and then quickly recognizing that when you take somebody off the street and you put them into a house or into a place with safe walls, life gets worse. At least if you're in full survival mode, you got nothing to lose. As soon as you have something to lose, every demon you have faced comes out biting. Like, it is rough. And the time, once you have that immediate threat of where do I sleep at night, once you have that alleviated, you get worse. You get worse and you become volatile. So Homes has been able to implement supports with helping people get through the volatility. That has looked like my mentor, who actually trained me, Bonnie in Hamilton. She and a few other peer support workers would go around and talk to people. They also coached staff who had been out, who got like education, coached them on mannerisms and how to treat people, how to treat somebody who's volatile. I struggle with psychosis and hallucinations. I've got a lot of disabilities. I've had times where we have a tenant who is difficult to connect with for some reason or another, and the team will reach out to me and be like, hey, Allie, I don't know what's happening. And I'm like, great, I'm going to talk to the person. And I chat with the person, and we come up with a game plan where they usually vent about how they don't feel supported. And I say, that's valid. I'm not surprised. What makes you feel supported? And then I get their consent. They're like, hey, yeah, you can go and talk to the team on my behalf. I go to the team. I tell them what me and the person talked about of how they feel supported. It's usually weird. Like, it's usually like, I want someone to ask me how my pain is instead of saying hello. I want someone to not look at me when they're talking because it makes me feel like I'm on the spot. I want someone to have specific body language so that I feel more comfortable. I tell my team that. My team trusts it. They go and do a visit following my advice. Then me and the team connect afterwards and talk about it, and usually the team is like, oh my God, it worked. What do you mean I just had to not give eye contact? And then we move forward. The funding question is great. I've got my contact info on the back here, so please reach out, and I'll try to provide resources. I'm lucky. I've been in this career for like 3 years, almost, and I don't feel stressed at work. And I don't know how exactly they developed it outside of treating me like I'm a diamond. I am important. I don't know. I know a lot of places don't have that view, but Homes does. Hopefully that answered. Okay, good. Anybody else for how peer support can affect your organization?
So I think partially to answer the previous question as well, we've had peers built in at Good Shepherd for like dozens of years at this point. So like it's been a very long-standing part of the program. So I think across Good Shepherd we have like a dozen now. And when we're building new programs, we're looking to always ask for FTEs specifically for peer support roles. So it's just something that's built in. Something else that we have done that's been really important is we've built our lived experience advisory council at Good Shepherd, which is a group of either current, previous, or service users, or just folks in our community. And they're used to, as their title would suggest, advise on program building, on policy changes, on whatever it is really that we want to bring forward to that group. And they've been a really incredible resource for us. So one of the first tasks that they took on was reviewing our satisfaction surveys and trying to adjust them in ways that made more sense for the people who were going to have to be answering them, right? If we're going to ask you to fill this paperwork out, then it may as well be more accessible for you. And so I think that that's a really important way as well. So even if you don't have the funding for direct peer service workers in your programs, this table is voluntary. There's some like honorariums involved. Like I think that there's creative ways to involve peers that aren't necessarily in the traditional staffing model as well, as a way to reshape how we're using peers.
Thank you, Emily. Emily also works for Good Shepherd, in case that wasn't obvious, just under a different program. quick couple notes too. When involving peers directly, food is so valuable. If you offer free food, it's great. Coffee too. Coffee is super effective. If you're looking to provide consultation as a peer, if you're looking to advise through like talking to cops, which I've done, or to like talk to the work and tell people how to reshape their programming, I would probably recommend reaching out to local community that deal with peers. Some churches will offer you funding. Like churches will literally be like, yeah, you go through some stuff, here you go. Things like Acorn, things like city enrichment funds as well. Like the city you're in, they usually have a city enrichment fund, and they're looking to fund things directly by people in the city. So you can find some funding that way.
Hi, thank you. That was really informative. Am I able to ask a question rather than respond to the prompts?
I think that's fine, yeah.
Okay. You talked about it a little bit in the presentation, and it was definitely woven in, but I was just hoping you could elaborate a little bit more on how, like, clinicians and peer support work together. And I know you mentioned some training that takes place in terms of how do you support youth that may be suffering from a lot of mental health or trauma that is beyond your capacity. So could you just elaborate a little bit more on all those intricacies and how that works together?
Cool if I take this? Okay, cool. So a few things you said in your question was peers working alongside clinical staff and then youth. So if we're looking through the youth lens, I don't support too many youth. I got a couple. If you're working with youth, the biggest thing is making them feel like they're super important. Weird ways of using Gen Z language. If you got anybody who knows anything about the media around, do it. Like just you sprinkle that in, you'll gain trust. Peers are more likely to open up. When it comes to peer support and clinicians, the training that can happen is a peer who feels really secure in their role can sit with a clinician and talk about the ways the clinician isn't being helpful. This can look like telling them, hey, these words you use are inaccessible. You need to change your language from using stuff that you would have learned in a book to language that is easy to understand as somebody who's 10 years old and dropped out of school. Most people who are like substance users, oh my goodness, or have trauma, have trouble with higher language, so that can be really inaccessible, and the person receiving care can feel really ashamed, but not want to talk about it because they feel dumb. That's something we do. Also, I've been called in on meetings where somebody's being, they've been hospitalized, they're going to be moving back into their home. I've gone with a team member to talk to the psychiatrist and social worker and try to talk about, what does this look like? Those conversations are usually the psychiatrist saying, everything's fine, this person is great. And me being like, this person has severe memory issues and can't remember to do tasks like taking medication on time. What does it look like when we offer that accessibility? And their response is, well, I mean, the nurses have found it great. The nurses are here. They've been able to support this person constantly. And I'm like, that's because the nurses show up every 2 hours. How do you support somebody outside of that? Where does that come from? And then they get usually an ACT team or an outreach team supporting. I've sat in on many a psychiatry appointment with a tenant, with one of my peers, where we did the game plan thing of me and the peer sit down, we talk about what do you want the psychiatrist to understand, what are they not getting? And then we have a tapping system, so the peer will either look at me in shock, and I know that's where I jump in, or they tap me, tag me in, I talk for a little bit until they feel confident again, and then we go back. So it's like scripting ahead of time so that when somebody's really under stress, they're able to log back in and not be overwhelmed. Other than that, if you're looking to get somebody, a person experiencing severe distress or using supports, if you want them to be able to advocate easily, supporting them with training is huge. I know somebody who is a tenant, who is with Homes, who we met a few times, They said they really wanted to be a peer support worker, and I was like, that's great. I don't have time to help you, but you can go talk to CMHA, and they usually have a peer support worker training program. Person did it and got hired as a peer support worker. So me and them got to chat about how they did the thing, and then now they get paid. Yeah, I hope that answered your question. If you have another one that's also totally chill.
I also was more curious about.
That's okay.
More about the link. Like, it's great. You kind of explained the reverse, but in the moments where you may be interacting with your like peer-to-peer, and it becomes evident that like the crisis they're in, like it requires more intervention than what your training can provide to you. Like, what does that dynamic look like?
Yeah, so those moments suck. No, you're good, you're good. I've had cops called on me and like had people come to my door and be like, we heard you're gonna do something bad. And I'm like, please go away. We do have to have those conversations. So if somebody is in a severe crisis and I'm like, okay, I'm gonna use my assist training, I'm gonna try to talk to you about suicidality or other things. Oh, it's not gonna work. Okay, we need to go to the hospital. We need to. And I've done it. I've gotten people to voluntarily go to the hospital with me. It usually means a lot of bargaining. I bribe by saying, while we sit and wait, I'll crochet for you. And then you get a butterfly, and it works. Navigated crying, the rage, the fear, and I sit and support. Peer support is meant to be emotionally connected, so we sit through it together. Somebody can lose it completely, and I'm like, all right. It doesn't escalate to direct violence usually. I don't face many fights. But I reach out to my managers. I let my management know, hey, this person's in crisis. I'm going to have to sit here for a couple hours and support. Sometimes it's, hey, the person's willing to go to the hospital, but only if I show up. So my day is canceled and I'm going to go support. Then we tag out a team member. I'll say, hey, I can't be here forever. Is there a team staff you'd be down with me bringing? These are your options. The person usually is like, sure, okay. And then we go to the hospital. I know forming people is also a thing. If somebody doesn't voluntarily go to hospital, that is something we deal with. I've done it. It sucks. But I also recognize as somebody who has been deeply not okay, sometimes you need more support, even if you're unwilling. I don't like the carceral actions of our society and of the systems we've got. I think peer support could go a long way in making it stop being that way. I think with enough peer support workers, you don't need to call police. I think with peer support workers, it's far more likely to get someone to voluntarily go to hospital, even when they know when they go to the hospital, the doctors won't let them leave. It works. You're welcome. I got 2 more questions. You good? Okay, good.
It's not a question. I just wanted to speak to funding really quickly to maybe answer your question. Do you work in Canada? So you can apply for SUEP funding, and it's federal money, and they support peer workers. So I'm from Wyndham House in Guelph, which is like 45 minutes close to where they are, and we've had peer workers for years through SUEP funding. Yes, substance use and addiction funding, so SUAP, and you can apply for funding through there, as well as Heart Hub funding, which I know just came out, but those are like 2 funding resources you can apply for peer supports. And it pays for like 2 full-time peer support workers, our youth advisory committee, full salary, full benefits, compensation for like mileage, program expenses, all those things. Yeah.
Look at peer support live, everybody.
Bonjour, je vais poser la question en français. C'est correct? C'est correct si je parle en français?
Oh, yes.
OK. Alors, merci pour votre présentation. Je travaille dans un organisme ici à Montréal et en fait, on est en train de travailler activement pour développer la pérédance dans notre gamme de services. Et ma question était concernant la formation en fait. Donc, d'où vient cette formation? Elle dure combien de temps, etc. Et justement, dans l'exemple que vous donniez, par exemple, des codes que vous prépariez à l'avance avec la personne pour rencontrer le médecin, est-ce que ça faisait partie de votre formation ou c'est votre propre compétence? Et la deuxième question, c'était en fait dans la sélection des pères aidants, parce que toute personne qui a vécu cette expérience n'est pas forcément prête à jouer ce rôle de père aidant. On a parlé en fait de réactivation de trauma, etc. Donc en fait, comment se fait ce processus de sélection et qu'est-ce qui fait que on est sûr de pouvoir porter ce rôle et de le faire de façon efficace? Donc merci.
Beautiful questions. You're welcome. As long as you're okay that I'm answering in English. Okay. Wonderful. First part is training in general. Peer support worker certification program. It's usually a couple of days a couple of weeks, sorry. I think I was 2 weeks in training. That is provided through Peer Support Canada. It is national, or whatever, federal, whatever. It goes across like BC, Ontario, everything. They'll give you a little certificate, and that you don't need recertification. There's also a handout, the National Peer Support Work Handbook. If you pull that up, it is a big book, but it will go through what a peer support worker needs to understand in order to provide service through certification. It's not necessary for a peer to have certification to provide peer support. It is just as close as peer support workers want to get to having like an overlooking body, similar to like a college of nurses or things. For how to talk to doctors, that's me, unfortunately. There's not really much, there's some training. When it comes to talking to a doctor, and you have somebody who struggles with reality or they struggle with or substances or whatever, I had a handbook I got from the Alzheimer's Society of Canada. So Alzheimer's Society of Canada works to advocate for people with memory problems, usually dementia, but they're starting to come out with like cognitive delay and other things. So they will list like, I forget to take my meds. How do I help taking my meds? Resources on ADHD as well is really helpful because memory problems are extremely common with ADHD. I kind of just copy and paste. I just have like a big old book of all these things that come across memory problems, skills that other people have used, and then skills that I use. Because I have had many years where people have had to come and sit with me. And usually it's not because I want them to. My partner has pushed, being like, hey, Ali, you didn't remember any of what the doctor told you? And I'm like, no. And he's like, I can't help you. So let's go back. So he started sitting on my phone calls with my consent after a bit, and then coming one-on-one, and then we got some friends to do the same thing. So when I support somebody, I could come from the place of it feels very shameful, and it's frustrating and sad. So I do my best to be gentle and be like, you're facing something that's unfair. It's not your fault that you can't remember stuff. It doesn't make you a bad person. You still need support. So how can we do this in a way where you feel like it's good? Because I know I wanted it to feel good. And yeah. The second part of the question, for how to support fathers, is really tough. So I'm trans, I'm non-binary, and have done a lot of my own work around processing gender. It's hard for men in general to have another safe man, somebody that they can look to as a mentor, someone they can look to as someone they want to model. I'm very lucky at this point in my life, at 29 years old, I've got men in my life. I've got a coworker who I go to get hugs from when I feel really sad. He's a cis, straight white guy. I've got my director that I admire. I've got Satvir. And I've got men around that I can kind of try to model when I need that support. I know that a lot of Indigenous and Native initiatives have oh, what is it called? It's something like Moose Hide or something. It's an initiative to support men in being kinder and more caring people. I would recommend reaching out to a local Native center to get that support. Because, yeah, what I feel like you're asking for there is elder support or a mentor. I don't know that there's many formalized versions, but generally, when I'm looking for support of a human being, I usually go for Native or Indigenous centers first. The community there tends to really value things like peer support, so I find folks are accessible. Yeah. Hopefully that answered. The next question we had, sorry, we do have another, unless somebody else has a, oh, sorry, never mind, I apologize.
I'm sorry. I've been given permission to ignore the discussion questions and ask my question. I manage a Housing First program in Ottawa, and we have obviously housing case managers, and we have 2 peer support workers on the program. And I think over the years, what we've seen with this role is that I think sometimes the peer support workers might try to model the approach that the case managers have. I don't know if it's, who knows, it could be internalized stigma, it could be something that we're doing, it could be an attempt to legitimize the role. And I'm just wondering, sometimes I want to say, we have 11 case managers, I don't need more case managers, I need a peer support worker. What have you found helpful in kind of encouraging someone to embrace those differences rather than try to conform with the rest?
Okay, so my answer comes in twofold there. First off is, as somebody who is in an overarching role, it can be really important to provide coaching to remind peers of what their job is. It's easy to forget. If it wasn't obvious, some of our peer support people can have memory problems. It is so much easier to model the things that are being shown by the people around you, especially when you're spending a bunch of time with people and when you want to belong. Yeah, it is hard. So as a manager, the ideal is you would have a tenant who feels safe with you, or a staff who feels safe with you, and they'll just talk about it. But when you're giving feedback and you're doing one-on-one meetings, you as a manager can actually have the values sheet of peer support, which is found on Peer Support Worker or Peer Support Canada. They have a bunch of handouts on the values, core principles, reflective questions, and you can use it as a guideline. Hey bud, this week, how did you show this thing in peer support? What about your most recent visit? Fit this. By asking that, it will align the peer to be oh, that's right, that's what's important. And then it comes naturally. Yeah, I would recommend that in one-on-one talks specifically, not in a group. We don't want to shame folks. Second answer for how I do it, I have all the printouts. They sit in my cubicle, so every day I look at them. I've actually got I think this one is through Support House in Oakville, Ontario. Support House is also wonderful. I love Support House. I haven't talked to anyone there, but they have great resources, so I love their website. But they actually have a reflective questionnaire, which goes through prep of I'm about to see a peer. Am I in the space for it? Have I done my own self-care? Do I feel grounded? If not, use one of my exercises. Then it says, during the visit, I need to remember, don't talk about myself too much. Make sure to ask specific questions, or how does it align with goals? And then it has a debrief section that you do on your own, which just says, what did I feel was successful? What could I improve? Did I ask the peer if they had a good time? Did I make sure they feel like this was a successful visit? Those are hugely important. I use those every day. When I show up at work, I sit with my little coffee, I look at my board, look at all the art that my peers have made with me, and then I go about my day. Thank you. Hopefully that answers the questions.
Sorry, I don't know if I'm taking up the last part of the time or not. Are we okay?
Are we good for? Great, okay, continue.
Okay. Thank you very much for sharing that. This has been I took a lot of notes. Yeah, and I'm not sure if this is so much I guess it's a response to the first question and something that our friend posed over here about the funding. And this isn't really an answer, I guess. More as I guess it's a reflection. But I'm a little bit new to the grant writing world, and something I've been learning is as we all know in here, like it's often quite a balancing act of trying to, it feels like, our funders, our systems, our institutions that have resources to provide for a lot of work to be possible. Even if they mean well or have really positive intentions, they haven't always kept up with the pace of the work and the learning of the work, I think. And one of the things that I've noticed over the years, and I think this is something that peer support and sort of any I think about the work that we're doing in Halton Region and where we're engaging with folks with lived experience and advocating for change and bringing people on board to collaborate and find actions. So much of it is kind of redefining outcomes, because every grant, no matter where you are, everybody wants to know, okay, what are your quantifiable outcomes to everything you're going to do? And so much of our work isn't quantifiable. A lot of it is, and that's meaningful, like the numbers of people being supported and all of that. But the meaningful, the human interaction, the sense of belonging, the community building, the all of the things that we can often, speaking for myself, underappreciate sometimes when we go into a space, that this is also an outcome that we're having. And so I would really, just as again, not really helpful in terms of this is how you get funding, but I think what I hope might happen is that in this work, that maybe together we find ways to kind of flip that model a little bit so that, we're advocating for the importance of process and relationship building and all of the qualitative, I don't even want to call it qualitative, the human things that the people in decision-making positions are providing funding. I just think that there's so much value to also saying, hey, we don't know what the outcomes are going to be, but we know what questions to ask and what work we need to do to get us started. Because I don't feel comfortable saying I know exactly what's going to happen because it's not up to me. So I think, that's the piece I find there's a bit of a disconnect. And I think in our work, maybe there's an opportunity to advocate for that, if that makes sense. But not an answer, but more of just more questions.
Yeah, no problem. Thank you. Yep, there's a question over here.
Do you have more questions after this to go through?
No, we're done. No, we're good.
We're just Q&A right now.
Yeah, we'll just officially
Let's call
open
it
this up to
Q&A.
Q&A. It is official.
Ce n'est pas vraiment une question, je vais parler en français. C'est un peu sur le retour des questions d'accompagnement médicaux des parents aidants. Moi, j'ai déjà animé une activité, la gamme, la gestion autonome de la médication, qui est faite que c'est en groupe, les gens parlent de comment ils vivent la médication qu'ils prennent, puis comment on se prépare à aller voir un psychiatre. Puis aussi, c'est important de dire que n'importe qui peut être accompagné quand il va voir un médecin, qu'on ait un problème de santé mentale ou qu'on n'en ait pas. C'est stressant d'aller voir un médecin, c'est un droit qu'on a, mais les médecins souvent refusent ce droit-là, fait que juste de base, mais si les gens, pour l'animation de groupe de pairs, la gamme, la gestion autonome de la médication, c'est vraiment fort intéressant, puis ça après prendre vraiment du pouvoir sur ce que les gens vivent et savoir qu'est-ce que tu prends comme médication, comment préparer à rencontrer un psychiatre, aller voir un médecin, est-ce que je vais être accompagné, c'est qui mon filet de sécurité? Mais si vous ne connaissez pas ça, c'est une approche qui se fait très bien en groupe et devrait être animée par des pairs aidants.
Oh, I'm so sorry. Thank you. Oh, that helps so much. Okay, merci.
Ignore father, replace with peer.
Dear, thank you so much. Okay, I apologize to answering the question earlier where I focused on fathers. Bear with me here for a second. Am I correct in saying one of the question was about how people decide what their safety net is if they don't know that? Or was this mostly a comment on how you do it? It sounds like you do it effectively in a group. Sorry? Not a question? Okay, perfect. Amazing. And thank you. It sounds like you do really good work. I like the group dynamic when it comes to assessing medication and sharing skills. It's hugely helpful. It is important to match people to people with similar lived experience. So if you're going to run a group or anything, having some sort of like base of this is what we share as people is huge. I wouldn't recommend putting a bunch of trans people in a group with people who don't know what trans people are. But it is huge. Skill sharing in groups is wildly magical, especially when there's food. Oh, another question or comment. Now I'm gonna sit. I'm sitting down.
So we currently have, we're in a transitional housing program. We have a Monday to Friday peer support worker and then another part-time.
Yep.
I really appreciate the presentation, and I'm very thankful for the handout also. I think we've been struggling a lot with trying to integrate the peer support in, I'd say probably 50% of the staff totally get it, on board, and the other 50 are often challenged with just how to work with a peer support worker. So we've had some one-to-one meetings, and we're a little bit different where the peer support worker isn't hired into our organization. They're contracted in through a peer support organization, which is good because they're very supported by that organization that knows what they're doing, because we don't. So I think from listening to your presentation, I think what we have not done well is trying to integrate them in and putting some structure into it. Because it was, hey, tell us what you're interested in. You know what you can do within your scope. Because when I look, I took a picture of it. It's not in my notes, but making sure you're hiring the right person. We knew this person was the right person, but we're not familiar with what skills they're comfortable doing. So now we're trying to put that all into place, which is why I'm very excited and thankful for your presentation. Do you have recommendations? So that's kind of the background of my question. We've met with the peer support worker. She's interested in doing some groups. Right now it's mostly very informal, kind of just hanging out. What does the client need? Accompaniment to programs or to appointments, or shopping, or to the bank and helping support that way. And then just kind of shooting the shit around the program. Yeah. Do you have recommendations on how to help the peer support worker? She knows she wants to do more, but she doesn't know what or how. And I don't know how to support her.
Yeah, no problem. Yeah, I get that. When I started in peer support, I had my training, and then it was like, world's your oyster. Go out and do stuff. So do you take any sort of info from the people receiving support? Do they have anything where they're like, these are my hobbies, these are my interests, these are these things? If so, if you do, then if you're able to get clinical staff or your non-peer staff, if they're able to do like an open group and have the peer come to it, that's hugely helpful. When I was starting, it was really important for me to attend the different groups and start understanding the vibe of the tenant, so a peer. So pretending that Allie's just a new coworker. They're just here to understand how to do literally anything. And then I got to do the group thing. So it was usually crafting, or if it's cooking, I go in and I'm a participant of the group. And then later on, that allowed me to start understanding, okay, these are what the peers really like. These are the groups they really like doing. I now feel more comfortable doing it. And then having a coworker swap. So instead of me coming in as a person doing just participating, I'm running, another person's participating. Yeah. One of our managers was incredible at this. Her name is Michelle Letourneau. I love Michelle. She does a lot of our joint events. She would have me come out, I would help out, and then she would also support me in creating new groups, and she would attend as well. And then we afterwards would talk about what went well, what went bad, how can we restructure this? And then getting feedback of peers too. Eventually peers started being like, this is what I want. I want to meet with somebody, I want to do this art, I want to have a social group, and then people will go to the group, they share numbers between each other, and you build community that way.
And I think it's not about the outcome, right? Like you're not always looking for what we're gonna get out of providing support. It's just being there with the person, and a lot of the time, it's not just peer support worker, but also the other clinical team start to feel that way. Sometimes we always want to look for results and stuff. It's not that important. Sometimes just being with the person is important. And I think just finding out how to engage with the person, being there with them. And I think that's what Ali is really good at. And they have built that trust and rapport with people where they don't look for an answers in every visit. I think they can come, people can open up, and it does take some time sometimes.
Yeah, of course.
So I asked this in another peer support session I went to. Do I need to
Wait.
Yeah, okay.
For the translation.
Thank you. So I asked this in another session I went to on peer support also. I think the other thing we're challenged with, and I don't know if you have any insight, is the one-to-ones that the peer support worker is having with individuals. We've tried to share with staff, the peer support worker doesn't need to share what they're talking about with clients. Like, that's literally their role.
Yeah.
You don't need to know this. But do you have any recommendations on, when they should? So we've said, if somebody, so we do have nursing staff and addictions workers and a social worker on site. So we do have a lot of clinical staff to support. And I think that's where they're challenged because they're used to being the people that know everything. Where the peer support workers are amazing and totally engaging with the clients, which is awesome. I lost my train of thought on what my question was now.
That's okay.
What the communicating part. So we've said basically, if there is somebody that you're needing support to do like a suicide risk assessment, we do have staff to do that here. We can try and support here without having to go to the hospital. Or any homicidal thoughts, we've kind of given those reportable things as a guideline, but other than that, is it just kind of?
So when it comes to the organization Homes is they need to do mandatory reporting. So the standardized I have to report. If somebody has homicidal, suicidal thoughts, if they've got a plan, all that has to be reported. I'm upfront about that. So it is hey, just a reminder, I'm a mandatory reporter. If the conversation starts veering that way, I'll have to be I gotta do the framework, but I'm sorry, this might damage our report, but I gotta do it. And they're no, I don't want it. And I'm we got to. So I do have to report those standardly. I also seek consent to talk about things that may be useful for our team. So an example would be if one of my peers is venting, being I hate this worker. They do all these things. It sucks. I can be are you venting? Or do you want this to be better? What do we want? Do you want to just share your thoughts and vent and feel relief? Or are you looking for something actionable to make it stop? Often they'll be okay, yeah, no, I actually want them to just treat me better. And I'm great, okay, let's do a framework. So what makes you feel like you're being cared for? And usually they're I don't know. They should know that. It's the worker's job. And I'm workers aren't mind readers, but I love this for you. And then we go through, okay, if you don't know that, who's a good worker here? Who's decent? What do they do that's different? We do that. Or if you don't have any workers that you feel that way about, who in your life makes you feel that way? And sometimes they'll be Ali, you do it. Just make them be better. And I'm okay, what do I do? Let's talk about what are things that make you feel safe? What makes you feel seen? And we keep going down until we get to a point of understanding. Or they become so exhausted that they're I actually hate this. I don't want to talk about it anymore. And I'm cool. I'll be here to talk about it again next time. Yeah.
Thank you. And you guys don't?
Yes.
Yes, we do.
Yeah.
I think the way we're trying to sort of move towards is documenting with peers, so they know what is being documented. But right now, the documentation is just standard as anybody else.
And is it in again, I'm hospital, so I'm very medical, sorry. Is it in the same documentation that the other? Okay, so I think that's where we're different because the peer support worker is contracted in, they don't have access to it. Okay.
Yep.
Okay, cool. Thank you so much.
No problem.
So it's 11:49, maybe one more question?
I do just want to take a quick second to thank everybody here as well. I didn't get to say that before a bunch of people left, but it means so much that y'all are here.
Hi, great presentation. I'm just curious, it sounds like the scope of your peer support workers in your organization is extremely vast, and including like extremely emotionally demanding situations. How do you maintain boundaries? Do you have policies in place for that? And at what point do peer support workers step back?
Yeah, so I've actually had to step back from peers. So that is a great question. It is severely taxing. Like my folks are volatile. Like I work with people who have been chronically or acutely unhoused or homeless. I've also been homeless. Part of being a peer support worker, and it's really important, is to be far enough along your own recovery that being in those triggering situations doesn't cause you another crisis. So when I go and hang out with somebody and they start going through their stuff, I have enough of my own self-care and my own recovery that I don't usually get triggered by them. I'm usually pretty good to hang on to my stability and really focus on as a peer worker, my goal is to be the support person I wish I'd had. If I had had someone in my corner, what would the best version of that person be? And then I get to be that. And then when I'm done with the peer, and it's usually if it's a really big session, after I leave, then it's aftercare. Because then it's, oh shit, I didn't have that person. I got to be that for someone that's magical, but I gotta grieve. So usually I'll go to managers and debrief. I'll cry in my car. I'll reach out to a friend and say, hey, this sucks. Being like, I'm having a hard day, send me love. And I do that. If somebody is extremely volatile and I can't bring them back, if I can't use my skills to like de-escalate is the fancy word, but like help somebody ground and tether to something good, then we have a time limit. I just straight up say, hey, we've been doing this for a while. I'm starting to feel bad. And I'm guessing you're feeling bad, but we have to kind of wrap this up a little bit. What do we do afterwards? Like, what are you going to do after this to feel better? Is there a person you want me to reach out to? Do you want me to contact the team? What is your plan after this? And usually they'll be like, I don't know. And I'm like, well, TV shows, your cat, a plushie, something. Maybe we do deep breathing together to both kind of come to a decent place, and then disconnect. When it comes to the framework of what peer support does, I have specific boundaries. Like tenants aren't allowed, like my peers are not allowed to reach out to me or connect with me after 9 to 5. I work a 9 to 5 shift. My phone is available between the 9 and 5. I also let my folks know I'm not a crisis worker. I don't get paid crisis work, unfortunately. So if there's a location or area that is very high crisis, I also will have set time to be there, like a couple hours a week, and then I'm out. I don't stick around and support every single crisis. And if somebody is in crisis, I'm not the person to connect with. I let my tenants know, my peers know, you can text or call me between 9 and 5. There's no guarantee I will answer. I will answer you at the most 2 to 3 days, depending on what's going on. We have our set visit days. I will call a half hour before the visit to just remind my tenant about it, to be like, hey, we have our visit coming up. Is that good for you? We can edit it throughout the week as well. If somebody needs support that I can't give, like if someone's like, I really want to do therapy, and I'm like, I can't be a therapist, I'll do referrals. If they're like, I want you to be the therapist, I don't want to go seek other support, I'll be like, that's outside my scope. I can't support you in that. And then it's an open door, so peer support is very much like, if this doesn't work right now, give me a call again later. We can chat, come to my cafes, come to the groups. My goal is never to leave somebody behind and be like, never call me again. The goal is always, this is what I can do for you in peer support. If what you want is outside the scope, then peer support isn't right for you right now. I hope that answered the question. You're welcome. Thank you. Thank you.
I think I can speak for many of us. Like, it's been illuminating and I think inspiring for those of us going back into the community and looking at our peer support programs. And I think there's a lot of inspiration here. So really well done.
Thank you so much. I hope everybody feels good. Yeah.